Last week, we'd reported on how the WHO team seems divided on what they found in China. And with each passing day, we're learning more about what happened in Wuhan during that so-called WHO probe. What went on there? And while we're still waiting for a full report, it is now amply clear that China was not being transparent, that China hijacked the probe. It dictated the terms for this investigation and presented selective data to shift blame. Take a look at this. China refused to share raw data with the WHO. This was data about the early cases, data that could tell us how and where the pandemic began. The WHO investigators raised a demand for this raw data. There were heated exchanges with the Chinese. Ultimately, China refused to share the data. The WHO team wanted to see data about 174 cases. These were early cases that date back to December 2019. But Chinese officials gave them something else. They gave them summaries, not raw data, summaries that they had compiled themselves. And these summaries showed that there was no evidence of the virus in medical records in Wuhan. So here's a question. Why is raw data so important to these investigators? We heard about this from Dominic Dwyer, a member of the WHO team that went to Wuhan. Here he is explaining why they had to see the raw data to make a fair assessment.
If you're really trying to go back to the very beginning to try and understand the sources, in the ideal world, you would go through it patient by patient by patient. And that's what we call a line missing. Now, obviously, all of that stuff is anonymous. You don't want the patient names or anything, but you want the details on, what were the questions asked, what were the responses, and what were the sort of analyses of the data. And that's standard practice for an outbreak investigation. In this situation, the Chinese gave us the results. We would have liked, I guess, to have seen the raw data, but that can still come.
China basically had the choice to share the data, but it did not. Instead, it tried to urge the WHO team to accept Beijing's version of events. And this includes the claim that the virus might have come from elsewhere. That's the theory that the Chinese have been trying to push aggressively. Without any concrete evidence, they've been trying to suggest that the virus came from some other place, some other country, a theory that even the WHO team included in its list of possibilities. That's how much China prevailed. The scientists tried other means, other methods. They sought data behind the scenes. They tried to tell the Chinese that they would refrain from making judgments without the data. But in the end, they had to make a compromise. The WHO team praised China's transparency while still pushing for more research, an approach that Dr. Tedros too adopted in the early days of the pandemic. The WHO had praised China's response last year, remember. We reported this. In public, the WHO team says the trip was a win, but apparently they feel they have very little information, very little that is needed to answer the critical questions, not enough clearly. So what's the data that this WHO team wants, but it doesn't have? This is data about 92 patients. These people were hospitalized in Wuhan. Reports say they had the symptoms of the Wuhan virus, like fever and coughing, way back in October 2019. The Chinese experts have said that they found no trace of the Wuhan virus in these early patients. But those tests were incomplete, and if China has nothing to hide, why not share the raw data? Why is it important? Because any evidence that suggests that China knew about the pandemic before December 2019 will only create more trouble for Beijing. It will then prove how China knew about the outbreak and tried to cover it up. Remember, during the WHO press conference in Wuhan, the Chinese side emphasized that they only saw the first cases in December 2019. But that was not the truth, apparently. According to one investigator, the WHO team has reason to believe that the outbreak in Wuhan was much bigger than what China admits to. That statement was made to an American news network by the lead investigator, Peter Ben Embarek. He feels that by December 2019, Wuhan could have had more than 1,000 cases, and as many as 13 variants could have been spreading in and around Wuhan. And these variants had slight differences when compared to the original strain. The WHO team wants access to hundreds of thousands of blood samples from Wuhan to verify these findings or these theories. But China so far has not let them examine any of this. All of this only shows how China has dictated the terms of the global investigation, how much China is still trying to hide. Whenever it is asked about data, it has denied those requests and instead pushed its own theories. The United States has already promised an independent verification of the claims being made by the WHO team. Expect a bigger showdown in the days ahead. WION is now available in your country. Download the app now and get all the news on the move.